Hey, y'all. Welcome to the Convos with Anita Santiago podcast. I am your host, Anita Santiago. Please like, share, subscribe, and follow the podcast on all the major platforms. If you'd like to reach out to me directly, you can reach me at convoscws@gmail.com and share your thoughts or request specific topics to be covered on the podcast. What are we talking about today? Men's mental health. If you've been following the podcast for a while, you know I've dedicated several episodes to men's mental health. I think I had 2 or 3 episodes in 2025, at least 1 episode in 2024. Men's mental health is something that doesn't get enough visibility, and I'm always happy to bring those topics forward. In some of the past topics, I talk about how we can create safe spaces for men to be vulnerable, to be emotionally open. This June, this Men's Mental Health Month, had me thinking about barriers to services for men who need mental health support. First of all, as a mental health professional, we know that there is a limited number of men therapists of any particular background. There's just a shortage. Men tend to not go into mental health at the same rate as women, so that can make finding a particular provider difficult. And also, many topics within the mental health arena are skewed, I feel, towards women, such as eating disorders, such as self-harm, and other topics. So I feel like those are a barrier too. So I want to take a few of these areas and talk about them, and then, in the hopes that I highlight some things for you. My goal is to always help us better support the men in our lives, and knowledge is power. So let's start with barriers to treatment. It can be very hard for men to find providers that they feel comfortable with. First of all, men are socialized in a lot of cases just not to be as open about their emotions. So sitting across from a stranger to discuss things that are going on with you can be difficult in general. But I think there's a lot of judgment that comes with the construct of maleness and masculinity in our society. So this can really discourage men from reaching out to find a good fit. If you have someone in your life, a son, an uncle, a father, a brother, or someone that you're trying to help support, encourage them to keep searching until they find a person that is a good fit for them. There are therapists that do all different types of treatment and have different types of modalities, so you have to find what fits with you. I just shared on my social media page a flyer from a male therapist in Maryland, because it's Men's Mental Health Month, and I try to share as many resources as I can. But he does walk and talk therapy. And this is a type of therapy where you're actually not in an office. You're out and walking and talking. That's a different type of therapy. I don't do that type of therapy. I'm not very familiar with it, but it's a great option if a person just doesn't feel comfortable sitting in an office to talk to someone. So if you have people that you're trying to support, just encourage them to keep trying. These healthcare systems and specifically the behavioral health systems are atrocious at helping people find the right type of provider for their needs. In the area of severe mental illness, there are very limited resources in most places for people to get help. So we want to encourage men to continue reaching out if you had a bad experience with someone. Don't let that discourage you from reaching out and trying to find someone else. There are more male providers, I feel like, in the last 5 years than the last 10 years. So look for those types of providers that are a fit for you. Another thing that we can, another area that needs to be addressed or highlighted is that, as I said a few minutes ago, the disorders that men struggle with that don't get visibility. Men suffer from eating disorders. Men have body dysmorphia sometimes, where they have difficulties accepting their bodies as is. There are also other types of experiences that, are really skewed towards women. If you have someone in your life that is struggling with something and they're just having trouble being seen and heard, there might be resources in the community that could be helpful. There are many, many organizations that support women in different areas, but the organizations that support men tend to be focused on substance use and drug addiction. So just an observation that I've had is that eating disorder clinics and other places, even though they might service men, when you go to their websites or when you're looking at the ads or the ads pop up on your screen, you constantly see women. It constantly feels like that's a woman's thing. I think this creates more barriers to men seeking services, actually. If you're struggling with something and you're being dismissed because you're a man, how could you have a problem with your body? You haven't necessarily gained weight from childbirth or other types, stereotypes that we have about weight gain. But there are absolutely men that struggle emotionally with some very, very hard things. Not just drinking, not just drugs, not just gambling, not just sexual addictions. Men deal with a lot more than that. And I think that this tendency for providers, organizations, and behavioral health systems to skew towards women in some areas create barriers for men to get help in those areas. And what do we know? That often men carry those problems and burdens quietly. If they can't find the help that they need, it can discourage them. And this Men's Mental Health Month, 2026, June 2026, I think we should all be committed to making sure that we are working towards helping the men in our lives find and connect with organizations and services that provide help. And I think another way the mental health arena is skewed towards men is services for ex-offenders and people re-entering society. Yes, that's a service that's needed, but it's almost exclusively skewed towards men. And again, I've highlighted in my other episodes unique mental health needs that men have. But we have to be fair and talk about the barriers that are created or the problems that occur with men getting assistance, getting help. So, yes, that's another area when you talk about ex-offenders and reentry. Now, people who work in those areas know that there are programs for women that service women, that focus on women. People who work in that area know. But I'm speaking of when people generally are looking for information or trying to figure out what is the best option for them. often it's more difficult than it needs to be. It's more difficult than it needs to be. And for those of us that do therapy, that work in areas of mental health, we often hear from men, it took me so long to find someone who listened. It took me so long to find someone who really heard my concerns and didn't just dismiss it. That really helped, or they found the interaction really encouraging. And I think that should alarm us as a society, as a profession. Psychologists, therapists, social workers, LMFTs, all of the people, nurse practitioners, all of us that work in this arena, we should be alarmed at the ways that men have such difficulty finding appropriate services. We should want to change that. We should want to do whatever we can. Yes, there are organizations that are working on this. Yes, there are organizations that's been down in the trenches for a long time. But at the you and me level, and I'm always encouraging people to be change on the ground where you're at the you and me level, how can we make this better? How can we do better? And I think, as I said in the beginning, knowledge is power. And knowing that, first of all, men have this problem. So when you say to a man, why don't you just go to therapy, or you need therapy? Do you really understand the cultural challenges that go along with men just asking for help in the United States? The United States has this, this radical masculinity concept that, men go out there and kill animals and, hunt and they do all these masculine things. And so therefore, any sign of weakness is bad. So when you're talking to someone, to a male, and you're saying, hey, you need to go get therapy, are you taking that into consideration? Are you taking into consideration all the different ways that men have trouble accessing services versus women in the mental health arena? Are you understanding how many men are misdiagnosed because people don't listen, or they don't put the effort in to understand what that person's experience is? I remember a situation where I'm talking to an individual that had, I think, 8 diagnoses and was on 15 medications, and they were an older person at this point, and they were really frustrated as to why they've been told they've had all these diagnoses and none of the medication worked. Guess what? None of that was accurate. And when he found out what he was really dealing with, and somebody took the time to actually put the pieces of the puzzle together and really help this person, it changed his life. It changed his life. And that's why helping men get the right type of services that help them move their lives forward is so important, because when people get it wrong, a man walks in to a therapist and talks about the frustration at work and maybe at home and all these things that are going on. And a therapist looks at that man and says that he has an anger issue. He doesn't have an anger issue, more than likely. He has a frustration issue. Perceived gender roles and responsibilities and pressure to perform at 100% all the time and never be down and provide, and all the things that society says that men should do, or that masculinity represents. And we often don't take that into account. And I think this is why so many men over the years have just given up with, yeah, no, I'm good. I don't need to talk to anybody. Because why would you keep trying if you're shut down, not heard, dismissed, not believed, or people just imply you don't have the right to feel that way? Well, you shouldn't feel sad. You shouldn't feel down. You're a man. Stand up, man up, pull yourself up out of bootstraps, and all the other cliches that are thrown around on a frequent basis. I can see why many men at some point say, it's not worth it. One of the reasons I got into therapy is because I've seen how the wrong diagnosis can devastate someone's life. The wrong diagnosis, the wrong medications, and then that person becomes much, much worse and never gets the help that they need because they have limited resources. They don't have good insurance. They're reliant on government assistance, and so access to high quality providers may be limited. And that happens more than we care to admit. That happens all around us, where men specifically may be getting substandard care, and there are many, many barriers to getting the kind of treatments or access to services that could help move their lives forward. So what am I saying with all of this? I'm saying that for each and every one of us that have men in their lives that we care about, this is a real thing. And, maybe we can be helpful by understanding what the men in our lives face when they try to get help. Understanding the barriers that they're running into, and maybe helping problem solve in finding appropriate services or treatment that would be helpful. The state of behavioral health is a whole hot mess, in my opinion, but that doesn't mean that we can't utilize what's good about it to help people. And there are a lot of men out here that would like help. They just are tired of running into barriers and treatment and providers that don't align with them. And then they give up. And we shouldn't allow that to happen. We shouldn't allow the men in our lives to give up on finding what may be helpful. If you have a chance, go back and listen to some of the past episodes on men's health. Like I said, there were 3 in 2025, around episodes 64, 65, something like that. And some episodes before then where I go in depth about men's mental health. Support the men in your life. Become knowledgeable about what's available in your area, who's doing what organizations are instrumental in helping men with different types of issues and problems. There are a lot of community resources out there, and I know because the podcast is worldwide and heard in a lot of countries, I just don't want to list resources here in the States, but this is something that we have to work on. Our goal should be helping the men in our lives get what they need so they can get to a better place. Simple. So, call to action. I always have one. Call to action. Get knowledgeable. Get knowledgeable about men's mental health. Get knowledgeable about what the men in your life struggle with. The men in your family, your friend groups. What do they struggle with? Get knowledgeable. And then see how you can help. It's not hard. We just have to do it. So, thank you all for stopping by. I always appreciate every fan, listener, and supporter of the podcast. I am your host, Anita Santiago, and until we talk again, happy listening.